quick Q-Sin, no oxygen, no trach tube, no abdominal tubes, no chest tubes, not on oxygen. Path is nice and clear, no clutter. Patient is in bed, lowest position, side rails are up. Just gonna readjust this really quick. I am using this Pillowman as my client because the other kids have gone to bed since the first video didn't work. So, Miss Hale is a 19-year-old female. She presented to the emergency room with bloody diarrhea. She's had IBS in the past and sometimes has bloody stools, but not this much. So, knock knock, Min and Sarah, I'm gonna wash my hands. Alright, Miss Hale, I'm gonna go ahead and get some vital signs on you. Blood pressure cuff. Oxygen under the tongue for your temperature. Go ahead and let that go ahead and work. How long have you had IBS for? For quite some time now. And then what provokes an upset of your IBS? Your food intake. Okay, does anything help? No, just avoiding your foods and avoiding your triggers. Okay, how many bowel movements have you had today? 3? Okay, and then typically how many do you have in a day? Anywhere from 5 to 10, and that's normal for you? Okay. Have you had any weight gain or weight loss? It seems like you've lost about 10 pounds from your previous weight about 4 months ago. Is that correct? Okay, good. Alright, so let's go ahead. I'm going to have you turn your head that way. Good, no JVD. Turn your head this way. Good, no JVD. And then can you give me your name? Good, Miss Hale. And then what year are we in? 2020. Good. And then where are you at right now? Good, the hospital. Okay, so I'm going to go ahead and do a quick assessment on you. Okay, go ahead and look at me and smile. Good, face nice and symmetrical. Gonna take a look at your eyes here. Good, they both dilate, nice and equal and round. I'm gonna have you sit up for me. Good, and I'm gonna listen to your heart. Good. S1 and S2 are present. No murmurs, nice and regular. Anytime I put the stethoscope on your back, just take a deep breath. Good. Alright, and this one. Alright, here's the front. Okay. And your last bowel movement was today. Are you having any frequency issues with urinating or any pain with that? No? Okay, I'm going to go ahead and take a look at your belly. Okay, everything looks nice. Non-distended right now. Skin is nice and warm for ethnicity, correct for ethnicity. Skin turgor is nice and elastic. I'm going to go ahead and listen to your belly now. Vowel sounds are active times 4 quadrants. Good. Okay, no crazy pain with with tenderness, no, not non-tender. Go ahead and fix your legs real quick. All right, go ahead and grab my fingers and squeeze. Good. Push and pull. Good. Nice equal strength there. Go ahead and relax. No swelling. Let me see your cap refill. Good. 3 seconds. Which finger am I touching? Good. Which finger am I touching? Pinky? Good. Okay. Let's check for swelling in your legs. Good. No swelling. Do you have any numbness or tingling in your feet or your hands? Good. Check your pedal pulses. Good. Check your cap refill on your toes. Good. Which toe am I touching? Good. Which toe am I touching? Good. Let's check your radial pulse here as well. Oh, wash my hands first. Super sorry. Alright, check your radial pulse. Good. Okay. Okay, so it looks like here the doctor has ordered Bentanol, which you may have heard of before. It's a common medication to treat IBS, and that's in IM, so it's going to be a shot intramuscular. So we're going to go ahead and give it in your glute, your bottom, your butt. So I'm going to go ahead and prepare that for you. I'll be right back. Okay, Miss Hale, can you give me your name and date of birth? Good. Okay. So I'm going to wash my hands, put some gloves on. I'm going to have you roll over to the side. And we're going to expose your bottom. Clean it with an alcohol swab. Okay. Take my gloves off, wash my hands, put new gloves on, get an alcohol swab the top of the medication, Bentanol, 2 milligrams per milliliter, 2 milligrams per milliliter, good. I'm going to draw up 2 milliliters of air, inject it into our vial, and withdraw 2 milliliters of medication. Good. Okay, ready? 1, 2, 3. Nice and slow. Good. And put a band-aid over that, and you can lay back down. Okay, now with Bentanol, it could give you a headache. We're going to watch for any dryness of the mouth, any dizziness, headache. So you just let me know if you have any adverse side effects to that, okay? So we are going to get, the provider's going to come in and do a digital rectal exam on you, and potentially do a colonoscopy and some lab work, okay? So I'll be back in a little bit. Here's your call light, and I'll come right back in. Wash my hands. Knock, knock. Okay, Miss Hale. So I'm looking at your results here, and it seems that the provider did find some frank blood on a digital rectal exam, which isn't uncommon. And you just got back from your colonoscopy, which did show a bleeding ulcer in your transverse colon, which was cauterized, but no other signs of bleeding. It seems like the doctor thinks that this may have been just a flare-up of your IBS due to the fair food that you had ate earlier in the day, over the past couple of days. So we're going to go ahead and discharge you. But I want you to return here if you have any severe pain, your bleeding has increased. Otherwise, follow up with your PCP. I want you to eat a well-balanced diet, high in fiber, no caffeine, no alcohol, no tobacco. Avoid fluids with meals, low-fat, low-calorie meals, plenty of fluids each day. Chew very well. Avoid sorbitol and fructose in your diet. Drinks. Reduce your stress. Try some yoga. Go out for a walk. Again, no caffeine. Avoid fluids with your meals. Low-fat, low-calorie meals. Avoid milk. Medications, antidiarrheal agents, and bulk-forming laxatives are good. Anticholinergics such as the Bentanol, which we gave you today. And we're going to go ahead and give that half an hour to an hour before each meal to help with your IBS. Do you have any questions? Okay. So go ahead, get packed up, and we'll have somebody walk you out. Thank you. Okay, Miss Hale, I see that you're back in the emergency room 2 days after you got discharged. Complaining of bright red blood in your stool, two yesterday and 5 already today. And you're having some severe abdominal pain, nausea, and vomiting. We're going to go ahead and get you down into endoscopy, get another repeat colonoscopy, and we'll get a CAT scan of your abdominal area as well. Go ahead and open up your mouth. Okay, I do notice that there are some sores in your mouth, and have you had any other pain recently that's changed in the past 2 days? You have some burning in your epigastric region and some pain. Okay. Otherwise, your head-to-toe assessment is very similar to before. Endoscopy, CAT scan shows a severe thickening of mucosa in the small and large intestines with some ulcerations in the duodenum and ileocecal junction, in addition to the previous one seen in the transverse colon. The provider seems to think that this looks like Crohn's disease, so I'm going to give you some information on Crohn's. It's where there are healthy and unhealthy parts of your intestines mixed between inflamed areas. Crohn's disease can occur in all of the layers of the bowel walls. Gastroenterology has officially diagnosed you with IBD, and they can be misdiagnosed until they become severe enough. Specifically, he diagnosed you with Crohn's disease and explains how it affects the entire GI tract. He's going to write for new medications and discharge you home tomorrow as long as you are stable. So I'm going to go ahead and report off to the nurse here. Alright, Becky, this is Miss Hale. She's 19 years old, came in 3 days ago, initially with an IBS flare-up. No other health history. Vital signs were all within normal range. We did prescribe her Bentanol IM in the emergency room, and she was discharged following a colonoscopy that showed a bleeding ulcer in her transverse colon that was cauterized. No other signs in the colonoscopy. They believe that it was a one-time incident due to some foods that she had ate the previous few days. Came back 2 days later, severe pain in her lower GI tract and upper GI epigastric region. Increase in amount of bright red blood in her stool as well. Took her back for another repeat colonoscopy, took her down to endo, gave her a CAT scan. Results were indicative of Crohn's disease. So she is now on anticholinergics and antispasmodics trying to control that Crohn's. Right now she is NPO with TPN feedings to try to let her belly and GI tract calm down. during this acute attack. She's cooperative, friendly, oriented times 4. Vital signs are all normal, nice and stable. Doctor is looking to discharge tomorrow. Alright? Miss Hale, I hope you get to feeling better.